So back to this critical access presentation. The other problematic aspect of it was I couldn't convince anybody on the board that there was a difference between being shipped out of our hospital and being shipped out of Sutter Lakeside. I believe there are three differences. First, Sutter Lakeside has a heliport, and they often use helicopters, or they're close enough to the next hospital that they use ground transport. And because of our geography, we almost always use fixed-wing aircraft. So you're looking at 3 trips, not 1. And the problem is, you can have air ambulance insurance, but it's not going to cover the ground trip at whatever hospital you end up at. Like, you know, you could end up anywhere from Portland to San Francisco or Sacramento or Redding, you know, somewhere in between. And there's no way that you're going to be able to insure yourself, I don't think, for all of those eventualities. For the ground transport. The ground transport from here to our airport is around $1,500. So it's a significant burden. And there's also much greater time. It takes a lot more time every time you're shifting somebody from another vehicle than it would be by helicopter transport out of Lakeside. The other difference, I think, is the weather. I think it's hard to argue that our weather is worse and more unpredictable than it would be in the Clear Lake area, and yet I couldn't get a single person on the board to see those differences. It was frustrating, to say the least. Yes, go ahead.
Yeah, what happens if you don't have the money after they transport you, then to transport you to the hospital, and you cannot pay for it?
You'll always get there. Getting back, I'm less sure about that. I'm not sure. Usually family get involved at some level. If someone's had that experience, please share it with me, because I'd like to know. Yes, Dr. Sankus.
Yeah. We had an experience like this in Stockton, California, right?
Yeah, if you would all just raise your hand and let me get over to you, that way we'll be able to hear what you're saying. And it might help if you stand up so everybody can see who's talking.
We had an experience like that in Stockton, California, and it was brought up the fact that is this transfer that you're talking about a medical necessity or an administrative necessity? The reason for that is, if it's a medical necessity, something that's administrative, then that plane was in an accident, there was a crash, or the patient was injured in transport. I think there could be a lawsuit against a lot of people.
I'm going to tell you an interesting story that applies to that. The answer to your question is it's administrative. It's a self-imposed 25-bed cap that they're not going to go over, because if they go over the cap, they lose the extra Medicare dollars that are funding this program. So we had a long discussion at a medical staff meeting on August 2nd. It was held here in town. And it was hosted by the president of the region, Mike Cohill is his name. And we had a long discussion about critical access, including topics like you just mentioned. After the meeting, a Sutter Health attorney who didn't even attend the meeting deleted 70% of the draft minutes. The critical access discussion went from several paragraphs to a discussion was held on critical access, and that became the official minutes for the meeting. It's unbelievably unusual to have somebody who doesn't attend a meeting, does not sit on the board, and doesn't even work for our corporation. Remember, we're still a separate corporation. An attorney from another corporation is deleting material from our meeting minutes. And that material, I was told, was deleted for just the reason you said. Let's say we're at 25 beds, and you or a loved one are put on an airplane and the plane crashes, or if you just it's not good medical policy to routinely be transferring sick people in this weather, or any weather. So what if you have a complication just from the medical condition? It exposes the hospital to a lawsuit, and that's, an attorney told me that's why they deleted all that information from the minutes. And it's just bothersome to me that we can't have a discussion like we're having right here, since it affects our health and our life and the lives of everyone who lives in this community. So it's a great question. Okay, I'll move on. The second issue I was going to mention is just this whole transparency issue. So I must have asked our CEO, as did Dr. Davis ask our CEO, 5 or 6 times for the previous critical access studies that have been done at our hospital. There was a study in '08, and there was another one that was done in August of 2012. And time after time, we were stonewalled and delayed. So by the time the meeting came around, we couldn't really adequately prepare. We never got them. But after sending some emails and comments to the Sutter executives, I'll call them, I was able to get both of the studies, and they're right here. And it's a total of 12 pages, I think, 12 or 14 for both studies. And yet I can't show them to you. And I also can't get the study design. I can't get the data that went into here. I called Michael Bell, who's the consultant who did both of these studies in Spokane last Friday. And I said, I'm on the board. Our hospital participated in this study. I'm a board member. I need to see the study design. I need to sort out real science from junk science. I need to see who you talk to. I need to see what diversity of opinions. And I got a rather terse email about an hour later that said, my client is Sutter Health, and as such, I'm not at liberty to release that information. What? To me, it's just unbelievable that a charity acts like this. If this was a private company, and there were other private companies doing business, that's one thing. But this is a charity that pays no taxes, and that's why when Dr. Caldwell and I spoke before the Board of Supervisors on Tuesday, we asked about having the taxing authority of this county look into Sutter's tax-exempt status. It was actually Roger Gitlin who brought this to my attention last summer and did a significant amount of research on the tax-exempt issue. And there are lots of different ways to calculate the number that we would have had in the county, and I don't want to say what my number was because I might be off, but it's a huge number in terms of loss of the tax base on land that was donated by someone in this room to Sutter for the purpose of running a monopoly. And this is how they behave. They throw board members out of the room. They won't release studies that are important to us. And they don't say things that are accurate. I'm going to really dance around using a word, telling somebody's lying, but we have over 30 examples of documented written statements on the part of Sutter executives to this community, the Board of Supervisors, the medical staff, and the board at the hospital that are just simply not true. It takes hours and hours to do the research. And then you find it, and you come up to them, and there's just this shoulder shrug. It gets back to the question that you were asking me about an objective truth and about following corporate law that's very troublesome. So, so that's kind of where we are in critical access. Go ahead.
I'd like to say something again. I have an article here from the July 12th Chronicle concerning Sutter Health San Francisco and how they're dealing with it. The board of directors has dealt them on the location of a hospital in San Francisco they're trying to build. And they quote them as saying they don't believe Sutter is dealing in good faith with them. That's in the paper.
They don't believe
Sutter is not doing in good faith with the Board of Supervisors in San Francisco, and that's in the Chronicle, July 12th this past year.
I went to, yeah, I'll just give a quick follow-up. So I went to San Francisco a few months ago, and I met with several physicians who are very familiar. They're trying to close St. Luke's Hospital, which is in the Mission District and has a poor payer mix. It doesn't have as many insured patients. At the same time, they want to build a 555-bed hospital called the Cathedral Hill Project, and it is a massive project. They were spending $3 million a month in consultants. So it's a massive project in downtown San Francisco. They had promised earlier that they weren't going to close St. Luke's, but then there was a small fine print tucked into one of the contracts that apparently allowed them to do that. And somebody found some sensitive memos in a dumpster that some Sutter executives had written and brought them to the attention of the Board of Supervisors, and that's what precipitated the Board of Supervisors stepping in and saying, this is not a company that deserves a green light on a 555-bed hospital project with tax exemption. Keep coming back to that tax exemption. Actually, it was Mr. Gitlin's data was shared with Senator Ellen Corbett, and also with Betty Yee, and she's the chairwoman of the Board of Equalization, as well as a supervisor in Alameda County who's looking at the tax exempt status of Sutter. The reason I think this is so fascinating is the people down in the Bay Area who are looking at it are staunch Democrats, and Roger Gitlin was, provided them some important information. We can work together on this. This isn't political. This is about our health, and it affects all of us regardless of political affiliation, and I think it's great that the Tea Party's recognizes that, and so do the Republicans and the Democrats. It was the Democrats that set up a 300 attendee town hall last summer, and we really appreciate their input, and I've spoken to the Republicans as well. Let's not devolve into some kind of partyism. This is not what this is about. But Roger's work was used as part of that study even before he was elected. So.